In this Osce, I will be performing an EJV. Our patient is in need of an EJV because there's no other routes for IV access and he may need fluids or medication. In this scenario, our patient is unconscious, so we are unable to gain his own verbal consent, but we are doing this in the best interests of him. I've got all my equipment laid out. My 2 salines have been drug checked, and then this has also been put into the syringe ready to go. The first step of the EJV, turning the patient's head on the side. This allows the EJV to distend and it pops up nicely, and we can see here that that's straight and ready to go. So first I'm going to sterilize the area with an alcohol wipe. And now I'm going to attach the syringe to the cannula, and I'm also just going to push some saline through, and that just means that I've reduced the risk of an ear embolism. So sharps are out, and I'm going to tamponade the vein up here, coming in at 15 to 20 degrees, and I'm just going to ensure I've got some flashback, come in 3 more millimeters. I'm going to advance the catheter and remove the needle. Needle goes straight into the sharps, and while I'm continuing to tamponade, I'm going to get the lower plug ready to attach like so. So I'm going to do the first layer of securing while I get the flush. Still got some flashback, and that goes nicely into the vein. Secure the rest of it, making sure we can see the insertion site. We put an extra bit of tape just across the top here, and we're going to put the date, time, and the size of the cannula used just along the side. Now when we're finding placement for our EJV insertion, we want to make sure we're higher up on the vein, just so we're away from the pleural cavity, and this just makes sure that we don't induce a pneumothorax. And when we're withdrawing our needle and advancing our catheter, we want to make sure that this is in one smooth motion, so there's no risk of puncturing the catheter and inducing a plastic or ear embolus into the vascular system.